Welcome back, guys. Today we are going to look at the intravenous therapy in nursing. Welcome back, guys. Today we are going to look at intravenous therapy in nursing. What is intravenous therapy? This is a method of giving fluid and nutrients directly into the body via a vein by the means of camera. The indications: to replace water and electrolyte losses when other routes cannot supply and rapidly. Indications: to replace water and electrolyte losses when other route cannot supply as rapidly as needed or efficiently as required. To supply the body with nutrition, nutritional requirements such as glucose, amino acid, protein, electrolytes, when the patient is unable to get them orally. To supply one or more components such as plasma substitute, or cell suspension. This, for example, the blood. To administer some of the drug, like intravenous drug, maybe said, any drug that is given to IV. To relieve shock, where the blood and fluid volume is reduced, e.g. in road traffic accidents. To prevent shock before and after operation. To treat dehydration. To replace blood loss in such conditions as hemorrhage and anemia. To replace blood loss in conditions such as hemorrhage and anemia. To dilute poisons and to flush out kidney. To force dialysis. Type of fluid commonly used: we have normal saline, also known as sodium chloride, 0.9% solution. We have dextrose, 5%. Also have dextrose, 10%. We have Ringer's lactate. Then we have strength dose. And then we also have hypertonic saline. We also have blood. We also have the expand solution. They act as volume expander. Then vein, commonly recommended for IV therapy. The vein on the back of the arm, on the forearm, and then the inner aspect of the elbow, lower extremities, and then scalp vein, as you can see in the diagram below. So let's look at the procedure for giving intravenous fluid. So we start with requirement. In the requirement, it is a trolley and sterile trolley. Start by setting. On the top shelf, we will have a sterile towel on which on the top shelf we are going to look at the procedure for giving intravenous fluid. We are going to start by setting a trolley. It is a sterile trolley. First we have to clean the trolley, and we start by setting from down and top. Then on the donor shelf, we are going to put one bottle of solution, intravenous giving set, padding splint, 2 pair of sterile gloves. We have chetoforceps, bandage and scraping, pair of clean scissors, tourniquet, blood marking tools and a towel, a drum of sterile swab, 4 receivers, razor blade, cannula, 2 ml syringe, nurse's apron, fluid balance chart, and then disinfectant. You can also add laboratory investigation form and the batuteners in case you want to get a sample. Then on the top shelf, you're going to lay a sterile sheet or the trolley. Then you put in the galley pot, one for swab, then one for antiseptic, then dissecting faucet, and a faucet, sterile receiver, a sterile dressing, a draper, and a sterile and towel. Then bedside, we have infusion stand, a small pillow covered with Macintosh, a screen, hand washing equipment, and safety box. So let's look at the formula for calculating the drop rate. So let's look at the procedure. One, you have to explain the procedure to the patient so that the patient knows what you are going to do. You have to provide privacy and bring the trolley near the patient to prevent comfort. And support the patient's arm on a pillow covered with the Macintosh so as to protect the sheep. Prepare the infusion and check if any particles on expiry date is due. Expel air and fill the fluid chamber to halfway. Apply tourniquet to locate the vein more easily. Clean the site with antiseptic. Insert the cannula through the skin into the vein. Connect the apparatus to the cannula and regulate the rate as prescribed. Wash hands. Record the amount, date, and the time of starting the infusion. Stand the patient and leave him comfortably and clear away. So these are the important points to observe during intravenous fluid. Factors that may affect the flow rate, and those factors are the position, the size of the cannula, the height of the stand, any presence of clot, the chambers if it is half full or empty. You should also take note of the chambers. So those are the factors And then care of the patient while on intravenous fluid, be observing the swelling on the side, the vital if it is on fluid, and then monitor. Then changing the infusion bottle or pack as per procedure. So in case the fluid is over, you should not make it to be there, otherwise the blood is going to be backflow into the giving cell. So we need to be changing the fluid as prescribed. Then discontinuing an IV fluid. You also have to follow the procedure of discontinuing the IV fluid. So in discontinuing IV fluid, you have to first close the chambers, you close the regulator. No. In discontinuing the fluid, you have to close the regulator, and then on the other arm of the cannula, you need to tap to prevent the backflow. You remove the giving set and then you close the trocar. So let's look at the complication of intravenous fluid. Certain complications may occur due to intravenous infusion. The nurse is expected to identify them in time and take appropriate measures. And these complications include thrombophlebitis. That thrombophlebitis, that infiltration, we have air embolism, speed shock, we have cardiac arrest, we have circulation overload. So let's look at the formula for calculating the drop rate. We use the formula of number of meals ordered. We're going to divide it by the hour ordered. Then drop factors. Drop factors we're going to see from the giving set. We're going to divide by the minutes. Then we bring us the drop to infuse per minute. And for example, a doctor has ordered 100 ml of normal saline to run for 10 hours. How many drops per minute will you regulate if you infuse with a set having a drop factor of 20. So we are going to put our figures. Orders per meal is 100 meals of normal saline to run for 10 hours. We have the drop factors of 20. So now we are going to put 20 over the hours, that is 10. We are going to multiply by 20 divided by 60. So our drop rate will be 33.3 drops per minute. So that is brief how we can calculate drop per minute or drop rate. That's all. Thank you for watching, and in case you come into exam, I hope you can do well. Thank you for watching.
to supply the good with nutritional requirements, just as glucose, amino acid, protein, electrolyte, when the patient is unable to get them orally. To supply one or more components, such as plasma substitute, or cell suspension, for example, blood. And we need minister some drug, like a government drug, which is personally chemical like to relieve shock where the blood and the body is not having damage. To prevent shock before and after operation. To replace blood loss, such conditions as hemorrhage and
Loro io ne venuti. Loro ya voy a tomar con.
Nó để tôi cà phê cà mô mà đồng la rồi.
La lo ni ne no wi lu che ya mate.
Cái này cái đó cái tao này.
Ma bene.
Sa đi.
Così